Here we are for episode 6 of the BE School and the Wellness Partners of Central PA.
Yes.
Yeah.
Yeah, be
hmm
better, be
hmm
empowered.
hmm
I am Emery. I'm the E part of B.
Yes, I'm Ben. I'm the B part of B.
Yeah, yeah. We hope
Yeah.
everyone's doing okay with January. We know it's the coldest and the darkest month of the year and everything, but hopefully we're here to shed a little warmth on your life and give you a little good, valuable info on how to take care of yourself physically in these cold winter months, right, Ben?
hmm That is right, because there's nothing like going through these months when you're nice and relaxed compared to being all jacked up everywhere. So,
Yeah, yeah.
hmm
So I think the jacked up that we're going to talk about today
hmm
is in the jaw, correct?
hmm
So for those who don't know TMJ, that's temporal mandibular joint. Most people just say TMJ because it's way
hmm
too much effort to say all that, but
hmm
that is the main jaw joint right here.
hmm
And we're going to cover that in today's podcast, in today's episode.
hmm
So are we ready to rock and roll, Ben?
We for sure are ready to rock and roll.
All right. So we were
Yeah.
talking about the jaw
hmm
joint, and I know I was talking to you before
hmm
the call here. I was a little surprised how high the incident report is when I did some
hmm
data searching on this.
hmm
Somewhere around 5 to 12% of adults in the U.S.
hmm
report at least having experienced one episode of TMJ pain.
hmm
I actually kind of thought the number would be smaller. So when I saw a number that was somewhere
hmm
around that 10%, it
hmm
I guess pun intended, it made my jaw drop a little bit.
hmm Yeah. Yeah. It's not as surprising to me, since I've definitely noticed that it's kind of like an underreported area. So it's one of those areas that I get a lot of feedback. For example, oh, I didn't realize that this particular area had all this tension in it, or something like that. So
Hmm.
it's probably one of those areas that kind of goes unreported by your body until you have a problem.
Yeah,
So
yeah.
yeah.
And then you probably do a pretty nice job at your massage
hmm
practice about just getting into those trigger points and those
hmm
muscles, and then all of a sudden people are kind of acutely aware
hmm
of how much tension they actually did have hiding in the
hmm
jaw, right?
Yeah. Yeah,
Yeah.
there's definitely trigger points in there, particularly at like kind of towards the attachment sites at the bottom and the top of the masseter. So
Yeah, well, that
yeah.
actually that's a perfect transition. How about
hmm
we go into the where is the pain right there? You're
hmm
already kind of talking to people about the masseter, maybe
hmm
just kind of educate people a
hmm
bit about where some of these main
hmm
muscle bellies are and
hmm
where we expect to see some pain.
Yeah, so they have the masseter, which runs all the way from the jaw all the way up, and where it kind of attaches up into the zygomatic arch
Hmm.
there.
So kind of
And
this distribution for people
hmm
watching on the podcast.
yep.
Yep.
Yeah, it's kind of that distribution, and it can be a very sensitive area around there. So the keys there are going very, you want to kind of stick right onto it, and you want to go really slowly and kind of, and yeah, do kind of that very slow dragging technique. And then if it's kind of been gummed up there for a while, no pun intended, then you can then definitely some friction in that muscle belly would not be remiss at all either.
Yeah.
And that
I
mm-hmm,
was going to ask, do you find yourself going up into temporalis muscle as well too? Because I think those are kind of the
mm-hmm,
two major jaw clenching
mm-hmm,
muscles that we have access to from an
mm-hmm.
external standpoint, correct?
Yeah, yeah, I mean those as well. When you're really, um, when you're really focusing in on that area. But I you know I don't treat that area just in isolation.
Mm-hmm.
I also would also treat um, the neck muscles, like kind of like in the back of the head, as well. kind of because how all of that is connected, um,
Correct. Yeah.
as well. So it's yeah, so a lot of you know, kind of stretching out the neck laterally, and
Mhm.
um, yeah, just a lot of there's a lot of um, like surrounding work you do as well as addressing the muscles that are kind of right around that joint there. Um, so with the yeah, and then the other interesting thing is that the masseter is actually I think it's the strongest muscle in the body.
Like
So the
pound for pound. Yeah.
yeah,
Yeah. Yeah.
yeah.
I
Hmm.
think it's like a reference of.
Hmm.
Did you ever see that movie Shawshank Redemption? Maybe
Hmm.
long time ago, but I know
Hmm.
that was like one of the threats that the main character made about like basically the biting power of the jaw and why a guy
Mm,
didn't want to do a specific thing.
mm,
But that goes back to what you just alluded, pound for pound, the power that that could generate. It's
hmm,
incredible. So
hmm,
therefore, not a
hmm.
surprise that there's going to be
Yeah.
pain in there. Sometimes
Hmm.
people will feel, as far as this, to add on to some of the other things you said, yeah, pain in the muscle bellies, but they can sometimes point right to the joint, and
Hmm.
they'll kind of feel like that tenderness right in there as well too. And certainly
Hmm.
with that tight association with the jaw and the
Hmm.
upper cervicals, it's you pretty much have to bet that if
Hmm.
somebody's coming in and they're saying their chief complaint's the jaw, like just like you, we have to go into the suboccipital muscles.
Hmm.
We have to go up into the upper cervicals because that pain in there can also just radiate back to the neck. But
Hmm.
even just the muscle behavioral pattern, they're going to work together. So we just kind of have to work on all of that.
Hmm.
What do you find is some of the common causes of pain for our TMJ people? Like, what are some of the activities and positions that they're doing
Hmm.
that get them in trouble?
Most of it I find is just teeth clenching
Yes.
that people do at night is the most common one. And I think we are also talking a little bit about before we started about some injuries that can occur
Mm.
as a result of some type of athletics and
Yeah, yeah.
um,
Well, let's think contact sport. It's
mhm,
it's January here, so I know the
mhm,
wrestlers are full swing, and every once in a while you maybe get put down to the mat or torqued a little funny, or somebody
mhm,
putting on a cross face and they hit your chin pretty well. Basketball guys might accidentally take an
mhm,
elbow to the face, or same thing with the volleyball players this time of year.
mhm,
But we're even going back to more of like the even more intense contact sport, like the hockey or the football guys that take a
mhm,
hit and they, thank goodness for the mouth guards. That reduces so many more of these
mhm,
injuries we'd see. But
mhm,
even the best of mouth guards don't exactly absorb all that shock that
mhm,
comes from the jaw, and it could be enough to still just
mhm,
put that TMJ out or
mhm.
over irritate the muscles in there, in
Yeah,
which case we're here to help, right?
yeah, yeah, because
Um,
that joint goes in so many directions.
yeah.
It translates forward and
Mhm.
back, and rotationally, and just you
And
know,
slides,
hmm
right? Slide
yep,
side to side, opens and close. So I mean
hmm
that's eight different cardinal movements just
hmm
right there. So
so yeah, so it's kind of like the shoulder of the mouth a
that's a good
little
way to
bit.
put it. It sort of is.
That
Yeah,
makes
yeah.
makes sense.
I love that you mentioned
Hmm.
the clenching
Hmm.
too. This is another area that we'll just see
Hmm.
people that are dealing with pervasive high
Hmm.
levels of stress. I mean,
Hmm.
you might even notice it if you're having a work day where you're just under a lot of stress and workload. You
Hmm.
might start to catch it's like I'm like doing this where I'm like got my
Hmm.
teeth gritted and everything. It's like, oh, just relax that jaw.
Hmm.
I like chewing gum, but we got to be
Hmm.
careful with chewing gum to
Hmm.
not overdo the joint right there.
Hmm.
People have to be careful about how they're yawning because if you yawn too hard and you let that
Hmm.
jaw snap, like that's something to
Hmm.
be careful of.
Hmm.
Another common cause of pain
Hmm.
as we sit here when we jaw off and we talk a
Hmm.
lot about TMJ, but
Hmm.
people that have to talk a lot at work,
Hmm.
sometimes that'll just the talking mechanism is going to
Hmm.
overwork all those jaw muscles potentially too, right?
Hmm.
So just to name a few
Hmm.
pretty common causes of pain,
Hmm.
right?
Hmm.
Right.
Yeah.
And then kind of common complaints, it's a little bit similar to where we said the pain was, but I was alluding to, and I want to elaborate a little further on the pain that's in the jaw joint itself.
Mhm.
I think the classic TMJ disorder that we see
Mhm.
is somebody that goes to open the jaw and they feel like a click and a painful pop
Mm.
right there in the joint of the jaw. And
Mhm.
that is probably the classic sign that if you're like opening, you're chewing food and you could hear clicking, grinding, and it's associated with
Mhm.
pain, and that pain zings up into the head here, or it zings down the jaw.
Mhm.
Um, it's time to come get some help from a
Mhm.
physical medicine provider like Ben or myself at that point.
Mhm.
That's a pretty common complaint.
Mhm.
What other types of common complaints do you believe we see, Ben?
Well, some of it could even be, um, te like feels like dental pain,
Oh, yeah.
almost, but it's but sometimes it's not anything necessarily with the teeth or anything
Hmm.
like that. Sometimes there's just there's a trigger point somewhere, probably in like the masseter. So then you can release those, and then that really helps a lot. Um,
Yep.
and usually those trigger points in the masseter, they don't like typically refer like up into the up into the head, or
Hmm.
into down into the clavicle, or what have you. But sometimes they do. So
Okay.
a lot of times they're like localized to there, so
Yes.
there can be a lot of different stuff going on there. But yeah, I mean commonly um, yeah, it's just kind of like pain, and people report just having like pain or tension in the neck and the jaw, with usually usually stress
Yep.
related, or they're just kind of in that like
Yeah.
holding pattern in front of a computer or something.
I hear you.
Yeah.
And two things I love what you said. You
Mhm.
mentioned tension, right? So I know we were talking about
Mhm.
pain, but sometimes part of the common complaints is not necessarily high level pain, but just like,
Mhm.
wow, I feel so tight in my jaw.
Mhm.
Um, that could be you leave that unchecked and then you could cross over the line to start to feel pain later.
Mhm.
Great point that you brought up with like the dental, kind of feeling like there's maybe something at the tooth level,
Mhm.
because this is one of those where sometimes people maybe sit and think to themselves, how could a dentist be connected to a massage therapist or
Mhm.
chiropractor? Like, what's
Mhm.
the connection?
Yep.
This is it right here. So there are times where it's actually a two-way street, where we have somebody that comes in and we think, hey, this is TMJ disorder. We get evaluating, we get inspecting, and then we realize, like, you know what? This doesn't seem right. Did you go into your dentist, and when's the last time you've gone, and have they checked for like an abscess tooth or like a cracked tooth or something? And
Mhm.
then lo and behold, they schedule within a couple of weeks to their dentist, get an x-ray, and it was a
Mhm.
tooth that was mocking like a TMJ disorder.
Mhm.
But it goes back the other way too. We've gotten referrals. I know I have gotten referrals from dental providers where they say somebody was coming in and kind of complaining of tooth pain, but they checked it out and they're like, there's
Mhm.
nothing wrong there. You might have TMJ. How about you
Mhm.
go have a couple of appointments with like a
Mhm.
PT or a chiro and have them work it up and see if that's the
Mhm.
cause of your pain. So
Mhm.
sometimes this area could be a little tricky, and that's
Mhm.
where it's nice that we have good relationships with our dental providers in town here, where we can pass it along when we're pretty confident that it's not really TMJ and that it's actually a
Mhm.
tooth problem.
Yep.
Yeah. So,
Yeah.
we were talking a bit about our muscles a second ago
Mhm.
here, right?
Yep.
I am always so enlightened and love learning you talking about anatomical chains.
Mhm.
So, I'm sure there are trains and chains that go
Mhm.
from the jaw and the masseter and the temporalis and tie
Mhm.
into the other areas as well too, right?
Mhm. Yeah.
So, teach us, right?
Yeah. Yeah. I mean, it's yeah. I mean, there's a lot
Of course.
going 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 on. All the it's yeah. I mean, you have you know areas going all the way from that joint, typically all the way um, down to the clavicle, and
Right,
down
right.
down to the shoulder. So you have pathways that run kind of like this way, and then
Yep.
also, it can also, from um, the muscles that are next to the spine all the way up
Yeah,
into
your
the back of the head.
thoracic, cervical,
Hmm.
erectors and
Hmm.
extensors and everything.
Yep.
Yep. Okay.
Yep. And spinalis and
Mm.
all of all of those. Yeah, and then also how you have them that those that wrap around the top of the head
Yeah.
as well, and then down insert down where the eyebrows are.
Yeah.
So yeah, I mean yeah, so that's why it's important to not just treat things in isolation, but also have more of a holistic approach
Yeah, well, and then I actually have
as
another
well.
question for you
Hmm.
based off of that, if you're all right with
Hmm.
that. So,
Hmm.
I know sometimes you'll do scalp massage, a little bit of
Hmm.
scalp massage work for
Hmm.
patients. So, is
Yeah.
the TMJ an area that you would, if somebody did come in and say, hey, the
Hmm.
jaw is kind of the main reason I'm coming to see you,
Hmm.
there's a strong chance you're probably working the chains up into the top of the head and the
Hmm.
scalp then at
Yeah.
that point? Yeah.
Yeah. Yeah, for sure. And then working on in the neck and the TMJ, and then also lengthening along that same side, even down into the chest, because and
Yes.
all this is connected also down into the ribs. There's
Yeah.
there's a lot.
Right, right, right.
But yeah, I mean, yeah, and also how when to also treat muscle on like the temporal bone with and then down in the mandible, and you know
I gotcha.
yeah.
Yeah. Yeah, I wanted to
Hmm.
continue a similar conversation because
Hmm.
it's similar to this, but
Hmm.
instead of the chains of the muscles,
Hmm.
I want to kind of educate people on
Hmm.
the weak, strong patterns that we frequently see.
Hmm.
So we've already been saying a lot that are masseter muscles. That's probably the number one muscle that
Hmm.
gets over tight, overloaded.
Hmm.
That's where the trigger points are really going to live. That's where we're going to
Hmm.
need to work the most. I generally find too that some work up in the temporalis, that's a muscle that likes to get tight too.
Hmm.
What I generally do in here is I'll work on the outside first, and I think most cases we get better just working on those two major muscles in
Hmm.
addition to the neck stuff.
Hmm.
But if it's a trickier case of TMJ and we got to slip on a glove and go and hit the pterygoid muscles, which
Mm.
that's usually not a fun experience to have to put the glove on and go and do like the finger stripping of the
Yeah.
muscle. But when people really need the pterygoids released, when they're that
Hmm.
tight and they're actually the primary pain driver,
Hmm.
oh boy, it makes a world of difference.
Yeah.
And then as a result, all of those muscles that I just listed actually are
Hmm.
jaw clenchers. They close the jaw like that.
Hmm.
And then we have a group of muscles that
Hmm.
actually focus more on opening up
Hmm.
the jaw. And the majority of them is there's the lateral pterygoid that does it, but then there's these sublingual muscles that
Hmm.
actually are part of opening up the jaw, and they do more
Hmm.
of that focus.
Hmm.
And just for a lot of us with our speech, with our chewing of food, with our
Hmm.
clenching with stress, we just get
Hmm.
weak on those jaw openers.
Hmm.
And so the onus is on us
Hmm.
basically to um, shut
Hmm.
these down, bring these back up in strength, right?
Hmm.
Which I guess takes us kind of into treatment philosophy right
Hmm.
there, right?
Yeah.
So we want to shut down the tightness that we're seeing in the masseters
Hmm.
and the tightness that we get in temporalis and that pterygoid.
Hmm.
And the more we can kind of like focus on strengthening to bring the jaw
Hmm.
openers back up into function,
Hmm.
that's what we want to do.
Hmm.
I also often find in my side of the office, and again, you kind of alluded to this with all the neck
Hmm.
work that we have to do in addition to jaw. But
Hmm.
typically, if we're doing our McKenzie method, we can find jaw specific directional preference movements, but we can almost be next to certain that there's going
Hmm.
to have to be some repetitive movement work done in the neck. Namely, people are going to have to work on retractions to
Hmm.
take that tension out of the suboccipitals that they're getting in association with the TMJ.
Hmm.
Um, but going through the McKenzie method of protocol, seeing if the
Hmm.
jaw has a directional preference movement, whether that's some sort of opening or a lateral slide, getting that for people to work on their own and have that therapy exercise at home.
Hmm.
and then getting to work with strengthening and stabilizing over time.
Hmm.
And then your treatment philosophy and assessment
Hmm.
philosophy over on your
Hmm.
side, little different than that though.
Yeah, a little bit different. We also do the muscle. We also put on the glove and go into the mouth and do some of that stripping of that other um, part of the masseter in there.
Yeah, and the pterygoid.
But
Yep.
it's um, not something that I've done often. So,
Same.
but
That's the same here.
yeah.
I don't do that often in practice, but when
Hmm.
it's needed, it's
Hmm.
needed, right?
Yeah. So with my philosophy, I start with the muscles in the back of the head and do some alternating movements a little bit, some like gentle rocking that to kind of key the body into that relaxation. So with that alternating movement that I can let go a little bit, and then I work from there around to usually the front, the front of the face and everything. Um, yeah, and there's yeah. So I tip, and then also probably am going to relax the muscles on the side um, before I um, move on to the TMJ. So it's usually like even if I'm going to be focusing a lot on the TMJ,
Hmm.
I usually will try to loosen kind of most other structures before I get into that area area and particularly with the masseter, you can use quite a bit of pressure in that area as well, so that can also feel good. Just make sure you're keeping just onto that area, not
Right.
and then also the communication is very key. And
Yes.
then that that is probably like the biggest thing, like to make sure that it's comfortable and that it's effective and that you're really providing providing really good care and not you know just making somebody's jaw hurt
Right.
or something like that. And
Yeah.
so then another one of I guess techniques
Yes.
is having the patient slowly slower is the slower better, kind of like open up the jaw, like
Hmm.
slowly opening and closing the jaw as you're getting um into the working out those trigger points and stripping
Yeah.
the muscle through there. And then something and then uh, that and then also you can have them clench as well and do things with that.
Hmm.
So there are quite a few things
Well, of course.
that you can do. But yeah, I mean, generally, it's it's yeah. I'm trying to create um, the most relaxed environment as possible to allow that joint to relax as much as it can.
Yep.
So
And the more you can get space off of a joint
mhm.
and the more blood flow you can get to
Yes,
the
yes, blood
muscles,
flow, like yeah,
yeah,
hmm
the more
yeah,
you're going to just speed up that
hmm
healing
yeah,
process and remove more of
hmm
the barriers to
hmm
healing so the body can heal itself the way that it's supposed to.
hmm
Sounds crunchy granola to say
hmm
that we are amazing, powerful
hmm
organisms capable of healing ourselves, but
hmm
it's because it's true.
hmm
And our jobs as providers is to take those barriers away, right?
hmm
And you had lots of amazing techniques on that. I would say how we fix it, it comes with that exercise first approach. And
hmm
so if we find that directional preference at the jaw, then
hmm
that's what the patient is going to go home and work on.
hmm
That's also going to help to kind of guide me on how I should probably overpressure the jaw for the patient while we're working on the muscles as well too.
hmm
You mentioned the open the jaw and have the contacts to strip through the masseters and the
hmm
temporalis trigger points.
hmm
Love that technique. I don't think there's a
hmm
single TMJ case I take where I don't do that.
hmm
Now, here's where I go a little 50-50 flip a coin. So,
Mhm.
depending on how irritated the TMJ is, we
Mhm.
definitely want to do some sort of cervical adjustment, whether that's traditional chiropractic, the snapping and cracking of the joint,
Mhm.
or if we feel like doing something that's more like a mobilization to encourage a little more neck traction with retraction in there is a better idea. We kind of play it by what the patient could tolerate
Mhm.
or previous medical history or their
Mhm.
expectations. Like there's a lot that goes into a decision of do
Mhm.
we adjust the neck. The
Mhm.
same is true with the jaw, though. There are actually jaw
Mhm.
adjustments, and they would look really similar to setting up a neck adjustment, except for
Mhm.
instead of making the contact on the articular pillar of the neck, the contact goes kind of
Mhm.
square on the jaw, and then we
Mhm.
can actually kind of do that rotary move with the neck and push the jaw along to really kind of reset that TMJ joint.
Mhm.
This is one of those, it just depends on
Mhm.
the patient. Some people we figure out like, hey, we need to hit that TMJ
Mhm.
joint. We need to open that up some more and get
Mhm.
that adjustment done. And other people, it's like, hey, you know what? We've been doing really well with more of the muscle work, overpressure, and stretching tactics. You're getting better that way. Let's
Mhm.
not go and do something that's too aggressive and runs the risk of setting you back. I would say
Mhm.
generally how I work with it is I start
Mhm.
without the adjustments and see how
Mhm.
progress is coming along.
Mhm.
Kind of a less is more type of
Mhm.
idea.
Yeah.
Because you mentioned how you got to be careful with not overdoing
Mhm.
it to just make it
Yeah.
hurt for the sake of hurting.
Yeah.
But then if we're plateauing out or just not seeing the progress, then as long as there's not red flags, we say, okay, maybe now it's time
Mhm.
to actually put the adjustment force on the joint
Mhm.
of the TMJ and see if that
Yeah.
makes a difference.
Yeah, and like a lot of what you're alluding to is the communication between the patient and the provider, which is so crucial because that can
It
almost
is.
it's like just as important than the techniques that are being done
Yeah.
because you need to have the feedback from the patient to know what's working and what they're comfortable with and what may be the best solution
Yeah.
for them. So,
100%
hmm
agree.
hmm
That's kind of a nice way to put a tidy little bow on it then.
hmm
So, I think we're gonna close out that because I think we did a
hmm
pretty good job covering this pretty well in depth, quite honestly. So
hmm
we don't want to talk your guys' ears off, right, and make our own jaws.
no,
We're
I
gonna have
don't
to
wouldn't
go
want
and do
that. No.
our own TMJ treatments on ourselves if that's the case.
hmm
But in closing, hey, I'm Dr. Emery
hmm
Pitcel. I am a chiropractor here at State College, Pennsylvania. My
hmm
office in my practice name is Rothrock Chiropractic and Rehabilitation. Find
hmm
us on YouTube here at Bodywork and Wellness Partners of Central PA.
hmm
And our practice is also on Facebook and on Instagram if you care to follow us. How
Yeah,
about yourself,
yeah,
Ben?
and I'm Ben Chiccarone of and you can find me at wellnesswaymassage.com.
Great, great. Well, otherwise, everybody be careful out there in the January. You know, make
hmm
sure while you're out here, keep yourself dressed warm. If it's
hmm
snowy, snotty, slippery, just be
hmm
careful out on the roads and
hmm
careful with those snow shovels because we don't
hmm
want too many of you coming in with like low back issues to have to see us either, right? But
Yeah,
I think from the BE school, be better, be empowered. I'm Dr. Emery.
yeah, and I'm Ben Chiccarone.
Have a great rest of your day, everybody. Thank you so much for watching.